Welcome to Smart Health Network. My name is Osawaro. Today's topic promised to be exciting and educative. We are discussing about premature ejaculation, also known as 2 minutes man. Alright, what is 2 minutes man? As the terms signify, it means the man ejaculated before 2 minutes mark. And today it has become a social discussion among women of different age group, trying to shame the men for being a 2 minutes man. It's also a medical term known as premature ejaculation, and it's also managed medically. Today we're going to discuss about the cause and the solution. Number one, what is the cause? The cause is one, psychologically, and number two, biologically. The psychological aspect of being a 2 minutes man could be related to anxiety, stress, and low self-esteem. Anxiety could be he hasn't done it before, or he has not done it for a very long time, he's just doing it now. That could be the problem why he's having anxiety. Another thing could be stress. Stress could be from work, from finance, and from the whole stress of life. And the more commonest one is finance. Most women do think that a man who has premature ejaculation or 2 minutes man is thinking of another woman, or he has done it outside. Whereas the man is thinking about where his next meal is going to come from, where is he going to have the next money to take care of his family and to continue living, providing good life for the family. And this most time creates a lot of stress, and the man becomes a 2 minutes man. Another reason is low self-esteem. Low self-esteem has been linked with lack of communication. We have seen a case whereby men live in a home where whatever he says is being used against him, and that lead to him having low self-esteem. It could be from work, people who try to bring him down in whatever means, and that has affected his ego, and he now have low self-esteem. It could be within peers, maybe because he doesn't have enough money, he doesn't dress nice, he doesn't smell nice, he does not have enough money to take care of all his bills, and that lead to him having low self-esteem. That as well could also result to premature ejaculation. These have also impacted the man and also our society. How has he impacted? Number one, it leads to frustration. The man becomes frustrated, he doesn't know what to do, he doesn't want to come home, he doesn't want to discuss what is happening in his life. This also will further increase the problem he's having. Low confidence. This premature ejaculation or 2 minutes man lead to low confidence, and the man begin to have lack of confidence in himself and his ability to deliver on his job and his life also. Communication breakdown. We have seen that the major problem 2 minutes man brings is communication breakdown. The man begin to have no reason to communicate with his wife or with his peer about what he's passing through. He doesn't want to discuss or share in the discussion among his peers or at workplace. Or he's thinking about how will he improve his sexual life. What are the solutions to this problem? Number one solution we have identified is behavioral techniques. This we will discuss further as we progress. Number two is sex therapy. Yes, you can see a sex therapy, a sex therapist that will help you understand what you are passing through. Because most time it's not a problem. You don't just know how to handle what you are passing through. We'll also discuss it further if we have time. Another thing is medical. We discussed about biological as being the cause of 2 minutes man, known as premature ejaculation, which is hormonal imbalance, erectile dysfunction, and prostate issues. These are medical issues, and that could be discussed with a doctor when you get to the hospital. As we have also always said in this channel, that it is very vital that a man go for a checkup. This also fall within the purview of that discussion. You need to also do checkup and discuss your premature ejaculation with the doctor. He will do some examination, do hormonal profile, check if you have erectile dysfunction, check your prostate health, and then your problem could be solved if it's biologically related. Another thing is communication. If you look at all my board, what we have here is communication related. You need to discuss with your wife, is also communication. If you can discuss with your parents about the problem, is communication. Seeing a sex therapist is communication. Seeing a doctor is communication. Hence, communication is a vital part of the solution for being a 2 minutes man or erectile dysfunction, premature ejaculation. Number 5 is practice. So we're going to focus the next minutes on discussing about behavioral techniques and practice. Number one, let's discuss behavioral techniques. What are behavioral techniques? That means you need to change your lifestyle. We have seen that a weak man physically will not perform optimally. It therefore means that you need to change your lifestyle. You need to up your game in exercise. And we have seen exercise that's very useful and efficient in managing a 2 minutes man. It's called Kegel exercise. I've also found another exercise that is very useful, which is running exercise. When you run, all your muscles in your pelvic floor within your groin are strengthened, and those are the muscles that is very helpful in sustaining your erection, and you will perform better. Do exercise, do running exercise. Don't sit in one place. Sitting for a long time have been known to be the major causes of erectile dysfunction and premature ejaculation. For those who sit for a long time doing their work, the heat produced, and the heat produced there has an effect on your productivity or your performance sexually. And also, it weakens the muscle within your pelvic floor, within your pelvic and groin area. These also have been seen as a major problem. If you want to strengthen the muscles around your pelvic floor and your pelvic, do exercise, running exercise or stretching, Kegel exercise. You see footballers, when they are, before they start playing, they begin to do stretching. Stretching your pelvic muscles, your pelvic floor muscles, your groin muscles, all the lower abdominal muscles have been seen as a perfect measure to help prevent premature ejaculation. Another thing we talk about, the number 5, which said practice. Practice have been seen as a major contributor to 2 minutes man, known as premature ejaculation. According to Jean-Baptiste Lamech theory of use and disuse of organ, which say that organ that you use frequently become very effective, and organ you don't use frequently become win out. So that means the regularity of your performance can also affect your performance to reduce your 2 minutes man or premature ejaculation. If you do, I've seen a video where the person said you need to do at least 25 times or so a month. That only helped in this case to buttress this point. According to Jean-Baptiste Lamech theory, which says use and disuse of organ that you use frequently become specialized. So if you do it regularly, your organ is going to improve. Your physical, your muscles are going to be used to getting the job done, and they will improve. So if you want to cure premature ejaculation, one of the way to cure it is practice. Do it as often as possible, and then you will see your system improve. And you can remember, I've not talked about drugs. I know drugs is what people look at as first line of action. That is not first line of action. There are other solutions that you can do to help your case. Until I come your way next time, my name is Remel Sawaro. This is Smart Health Network. Thank you for listening. See you next time.